Hello everyone, today we're going to be talking about overdose of NSAIDs or non-steroidal anti-inflammatory drugs. Just a quick overview of how these work. So firstly, let's talk about the COX enzymes, which I'm going to simplify this right down. They basically convert arachidonic acid into prostaglandins and prostacyclins. And these do a number of things. One is they help mediate pain. Another is they promote healthy upkeep of the GI mucosa. They also aid in keeping up renal blood flow and help with platelet aggregation, amongst many other things. So if we block a COX enzyme with an NSAID, which is what they do, then we're going to get a decrease in pain, but we're also going to get the common side effects of NSAIDs, so GI upset. We could get renal failure, especially if it's co-ingested with other things that precipitate renal failure. Maybe we get bleeding. That's more of a theoretical risk than one that's been proven. Now, the first thing to note is that when people take overdoses of NSAIDs, they get overwhelmingly good outcomes. And this is backed up by data in the literature. There's been hardly any deaths over the last few decades from NSAID overdose. There's a paper here that discusses some serious morbidity associated with chronic overuse of NSAIDs, but these people were taking 30 or more tablets a day for years on end, and some of them did end up really sick with major GI hemorrhage, and one of them ended up getting a gastrectomy. Still, none of them died, but they were really abusing the medication, so this was not a one-off overdose. There was this case report of a 14-year-old who took a massive overdose of 500 tablets of ibuprofen, which came to 100 grams. And he actually ended up requiring inotropic and vasopressor support and ended up on ECMO for 3 days. He was still able to be discharged from medical ward 6 days after that with absolutely no long-term consequences to his physical health. So what is the toxic dose of a non-steroidal anti-inflammatory? Well, the one that we know the most about is ibuprofen. And the dose of importance seems to be 400 milligrams per kilo of body weight. With amounts less than that, you're unlikely to get serious toxicity. Now, what are the complications you can get from an NSAID overdose? Well, you can get abdominal pain, nausea, and vomiting. You can get an acid-base disturbance, so typically you get a metabolic acidosis, although this only happens in very large overdoses. And you can get renal impairment. They have been known to cause seizures. There are a number of case reports to do with this, particularly with mefenamic acid. But again, seizures are quite rare in NSAID overdose. So mefenamic acid is the one that's most prone to cause seizures. The threshold is quite a lot lower than for other anti-inflammatory medications. So only 25 milligrams per kilo would be enough. And you can get quite a delayed onset of the seizure. So sometimes if they've taken a really big overdose of mefenamic acid, they could be monitored for up to 12 hours to make sure they don't have a seizure. Now, what's the management of an NSAID overdose? Well, don't forget charcoal. There's not really any data to support its use specifically in NSAID overdose, but it's going to be almost impossible to come up with any such data given that almost everyone does very well after one of these overdoses anyway. But if someone's taken a very big overdose, probably worth considering charcoal in the first 2 hours. Otherwise, treatment is largely supportive and consists of resuscitation, correcting acid-base disturbances, managing their renal perfusion, and making sure that their electrolytes are all normal, and then managing any GI complications that might arise. Almost all patients can be discharged within a few hours of presentation to hospital.